Welcome to the deep dive. Ever had that sudden moment of panic when your vision just seems to disappear?
Yeah, it's a scary thought.
Definitely. Today, we're diving deep into sudden vision loss, which is a really, concerning issue that demands our attention pretty quickly.
Hmm.
We've got a solid set of revision notes here, and our mission really is to pull out the crucial information, what it is, what triggers it, and, well, why understanding it quickly is so vital.
Exactly.
Think of this as your kind of shortcut to a clear and memorable overview, covering everything from the definition right through to how it's handled.
And it's important because sudden vision loss can be a red flag for a number of things happening, in the eye or sometimes even elsewhere in the body.
Right.
What's striking, I think, is the sheer range of potential causes. It really underscores how many different systems need to be working correctly just for us to see clearly.
Okay, let's get right into it then. What exactly do we mean by sudden vision loss?
Simply put, sudden vision loss is a rapid and unexpected decrease or even complete loss of sight. Could be one eye, could be both.
Okay.
The speed of onset is the key thing here. It happens fast, usually within minutes to hours.
Wow.
And because of that rapid nature, it's almost always a sign that, immediate medical attention is needed,
Yeah.
seriously needed.
And our notes mention something called Transient Monocular Visual Loss, or TMVL. What's the lowdown on that?
Right, TMVL. Think of it like a temporary blackout, but just in one eye.
Ah,
It's defined as a sudden, brief episode of vision loss, just
Right.
affecting that one eye, and crucially, it resolves completely within 24 hours.
so it goes away on its own.
It does, but, and this is important, even though it's temporary, you absolutely shouldn't dismiss it.
Right.
TMVL can sometimes be an early indicator of, say, underlying vascular problems. So it's still something to take seriously and definitely get checked out.
Okay, that makes sense. So we've defined it. Now, what are the common causes? It sounds like quite a list brewing.
It's a diverse group, yeah.
Eh.
Our revision notes highlight some common culprits behind sudden, painless vision loss specifically.
Painless. Okay.
Yeah. So think of issues affecting blood flow, what we call ischemic or vascular problems.
Like clots.
Exactly, like a blood clot forming right there, that's thrombosis. Or maybe a clot traveling from elsewhere, an embolism. Or even inflammation of arteries, like temporal arteritis.
Okay.
Then you've also got things like vitreous hemorrhage, which is basically bleeding inside the eye.
Right.
Retinal detachment, where that light-sensitive layer at the back pulls away.
Oh.
And even retinal migraine can cause it.
Ischemic and vascular issues.
Yeah.
You said that's like problems with the eye's plumbing system.
Yeah.
Tell me a bit more about how that leads to vision loss.
Precisely, yeah. Plumbing's a good analogy.
Yeah.
These involve a disruption of the vital blood supply to the eye. For instance, there's a term, amaurosis fugax. That's the medical term for that fleeting loss of vision, specifically due to a temporary drop in blood flow. And patients often describe it quite vividly, actually, as a curtain coming down, or maybe a shade being pulled halfway down a window.
That's a clear image.
It is, isn't it? And it's helpful because it visualizes what we call an altitudinal field defect, where you lose vision in either the top or the bottom half of your visual field.
Got it.
Another important vascular cause is ischemic optic neuropathy. This can happen when the short posterior ciliary artery, which is a key blood vessel for the optic nerve, gets blocked.
Okay.
So you see, many instances of sudden painless loss point towards these plumbing issues, highlighting, the delicate balance of blood flow needed for sight.
That curtain coming down description is really vivid, like you say. How do we tell these blood flow issues apart from some of the other painless causes? Like you mentioned posterior vitreous detachment, retinal detachment, vitreous hemorrhage. What are the telltale signs?
Yeah, this is where those specific symptoms really guide us. So posterior vitreous detachment, which can sometimes lead to a retinal detachment, that often presents with sudden flashes of light, like the lightning streaks and the appearance of new floaters. Those little specks or strands drifting across your vision.
Okay, flashes and floaters.
Exactly. Then retinal detachment itself often has that curtain or veil sensation you mentioned, progressively blocking the vision. Often starts from the edge, the periphery, and moves inwards.
Towards the center.
Right. And interestingly, patients might also notice that straight lines suddenly look wavy or curved.
Oh, okay.
And then vitreous hemorrhage, that's the bleeding into the gel inside the eye. That typically causes more of a central blurring of vision and a sensation of dark spots or maybe cobwebs floating around.
Those differentiating factors are super useful. Are there any other significant causes? Maybe ones that aren't always painless?
Yes, absolutely. While we've focused on the painless ones because they're common differentials, we can't forget other possibilities. Sudden vision loss can also stem from optic neuritis. That's inflammation of the optic nerve. Macular degeneration, though, the vision loss there is usually a bit more gradual.
Right, less sudden.
Less sudden, exactly. Stroke affecting the visual pathways in the brain, direct injury to the eye ocular trauma. Acute glaucoma often does come with significant eye pain. That's a key difference.
Okay, so pain can be a clue there.
Definitely. Complications of diabetes affecting the retina, diabetic retinopathy, and even sometimes as a side effect of certain medications.
Wow, quite a range.
It really is. So getting a detailed history from the patient is absolutely crucial to start narrowing down these possibilities. Given this wide range, who are the individuals we should be particularly concerned about? That brings us to risk factors, doesn't it?
That's a great transition. So who is most at risk of experiencing sudden vision loss?
Well, age is a significant factor. The incidence definitely increases as we get older, particularly for conditions like age-related macular degeneration. Having pre-existing health conditions also plays a big role. Things like glaucoma, polycythemia, that's a condition where you have too many red blood cells.
Right.
High blood pressure, so hypertension and diabetes. They all elevate the risk.
Makes sense.
And then certain lifestyle factors and other circumstances contribute too, like being on blood-thinning medications, anticoagulants, experiencing side effects from other meds. Smoking is a risk factor. And of course, having a previous history of other eye problems.
Okay, we know the what's and the who. Now let's delve into the how, a bit more of the pathophysiology. How do these various causes actually lead to vision loss at a, biological level?
Yeah, the underlying mechanisms really vary depending on the specific cause, but we can spot some general themes.
Okay.
A lot of these conditions involve, fundamentally, a disruption of the normal blood flow to the crucial structures for sight.
Back to the plumbing.
Back to the plumbing, exactly. That's the eye itself, the optic nerve carrying signals to the brain, and the retina, the light-sensitive bit at the back. When these structures don't get enough oxygen and nutrients because the blood flow is impaired, well, their function gets compromised. That leads to vision loss.
Okay.
Other causes involve direct damage, like a tear in the retina leading to it detaching, or bleeding within the eye that just physically obstructs light getting to the retina.
So with such a diverse range of potential causes, how do doctors actually approach figuring out what's going on in a specific patient? What does that process of differential diagnosis look like?
The differential diagnosis is essentially a process of elimination, really.
Right.
You consider all the likely conditions that could explain the patient's symptoms.
Right.
And then you systematically evaluate them using the history, the examination, to arrive at the most probable diagnosis.
So what's on that list?
In the context of sudden vision loss, the key conditions we'd definitely be thinking about include retinal detachment, blockages of the central retinal artery or vein. Those is vascular events again, inflammation of the optic nerve, optic neuritis, macular degeneration. Keeping in mind the onset is usually slower, stroke affecting the visual parts of the brain, any injury, ocular trauma, and then a variety of other eye diseases that can sometimes, present suddenly.
Do we have any idea how common sudden vision loss actually is? What's the epidemiology look like?
Our revision notes mention that the exact prevalence in the UK isn't precisely documented.
Oh, yeah.
Which isn't that unusual for emergency situations that have lots of different underlying causes feeding into them.
True.
But the crucial point to remember, the take-home message, is that sudden vision loss is considered a serious eye emergency, an ophthalmological emergency.
Right. Urgent.
Absolutely urgent. And while it can affect people of all ages, certain causes, like those vascular occlusions we talked about, and age-related macular degeneration, they definitely become more likely as we age.
Okay, so imagine a patient walks into, say, A&E describing sudden vision loss. What are the key symptoms and signs they might present with? What's the typical clinical picture?
Well, the visual symptoms are, of course, the main thing. Patients will often report a really rapid and significant reduction in their sharpness of visual acuity.
Okay.
And that can range from just blurry or distorted vision all the way to a complete loss of sight in one or maybe both eyes. They might also describe noticing a specific pattern of vision loss, like that altitudinal loss, the curtain effect we discussed with vascular events.
Right.
Or the peripheral vision disappearing first and then creeping inwards, which suggests retinal detachment.
And what about other symptoms besides the vision itself?
Yeah, accompanying symptoms can offer more clues. While pain isn't always present, as we said, it can be a feature, particularly in things like acute glaucoma or that inflammation of the temporal artery, arteritis.
Okay.
Those flashes of light we mentioned often point towards a posterior vitreous detachment or maybe an actual retinal detachment.
Right, the flashes.
And the appearance of floaters is commonly associated with posterior vitreous detachment or potentially a vitreous hemorrhage, the bleeding.
Got it. So given how urgent this is, what kind of investigations can someone expect if they experience sudden vision loss?
Prompt medical evaluation is absolutely essential, non-negotiable.
Right.
The first step is usually a really comprehensive eye examination. This will include checking how well the patient can see on the chart, visual acuity, assessing how their pupils react to light, measuring the pressure inside the eye, intraocular pressure, and a detailed look at the front of the eye using a special microscope called a slit lamp.
Okay, the basics first.
Exactly. Then, to understand the pattern of vision loss better, a visual field test, sometimes called perimetry, will likely be done.
Hmm.
And crucially, to get a good look at the back of the eye, retinal imaging techniques like fundus photography are used. That lets us actually visualize the retina and identify any abnormalities like bleeding, paleness of the optic nerve, or, a detachment.
And once a diagnosis is actually made, what does the management or treatment typically involve?
Well, treatment is highly specific to whatever the underlying cause is, which is why getting that correct diagnosis quickly is so critical.
Makes sense.
The goal is almost always to try and save or restore as much vision as possible. Treatment options can include medications, for example. Steroids might be used for temporal arteritis, or eye drops to lower the pressure in acute glaucoma.
Okay.
Surgical interventions are often necessary, like surgery to repair a retinal detachment.
Right.
Laser therapy can be used for certain retinal conditions.
Mm-hmm.
And in some cases, like a blocked retinal artery, there might be attempts to restore blood flow with treatments like thrombolysis, dissolving the clot, but that needs to happen extremely quickly, like within hours.
So time is really of the essence. What about the long-term outlook for someone who's experienced this? What's the prognosis generally like?
Yeah, the prognosis really varies quite significantly based on what caused the vision loss in the first place and how promptly and effectively it gets treated.
Right.
Generally speaking, the sooner a diagnosis is made and the appropriate treatment is started, the better the chances of a good outcome.
Okay, that's hopeful.
It can be. However, it's important to be realistic too. Some causes of sudden vision loss can unfortunately lead to permanent vision impairment, even with the best, quickest medical care.
And what are some of the potential complications that might arise from sudden vision loss, besides the vision loss itself?
Well, the most significant complication, obviously, is permanent vision loss.
Yeah.
That can have a major impact on a person's ability to perform everyday tasks, driving, reading, recognizing faces.
Yeah, quality of life.
Hugely affects quality of life.
Mm-hmm.
And this can also lead, understandably, to emotional distress and psychological challenges. Coping with vision loss is tough.
Absolutely.
And again, the likelihood and severity of these complications are closely tied to the underlying cause and, how successful the treatment ultimately is.
This has been an incredibly thorough overview, really helpful to help make sure this information sticks. Do we have any memory aids or maybe some example questions we can use? For revision, perhaps.
Absolutely. Revision aids are key. To help remember some of the common causes of sudden painless vision loss, you could try this Mnemonic. Vessels Ripped Retina Transiently.
Okay, let's break that down. VRRT.
So V is for vascular causes, think artery or vein occlusions. R is for retinal detachment. The second R is for retinal migraine. And T is for TMVL, that transient monocular visual loss, or you could link it to vitreous hemorrhage too, as it often presents painlessly.
Vessels Ripped Retina Transiently, VRRT. That's actually a fantastic way to keep those key painless causes in mind.
Yeah.
How about some example questions to test our understanding?
Sure, let's try one. A 70-year-old patient with a history of hypertension presents with sudden painless loss of vision in one eye. Examination of the back of the eye, the fundoscopy, reveals severe bleeding in the retina. What is the most likely diagnosis? Okay.
History of hypertension, sudden painless loss, severe retinal bleeding. Based on what we discussed, that sounds like a central retinal vein occlusion.
Spot on. Central retinal vein occlusion. And a little memory tip to link it. Think of vein occlusion being linked to high blood pressure issues and causing hemorrhages like a blocked, backed up pipe bursting and leaking blood.
That's a really helpful connection. Okay, let's try another one.
Okay. A patient describes the sensation of a curtain coming down over their vision. What is a key condition to suspect?
Ah, the curtain. We talked about that. That strongly suggests retinal detachment, right?
Exactly. Retinal detachment. And the memory tip is pretty straightforward here. Like, just picture a curtain physically detaching from the window and falling, blocking your view.
Excellent visual. Okay, one more for good measure.
Sure. What are the typical visual symptoms associated with a posterior vitreous detachment?
Okay, posterior vitreous detachment. That was the one before a potential detachment sometimes. Flashes and floaters.
Perfect. Flashes of light and floaters. And the memory tip. Imagine the vitreous gel inside your eye. As it shrinks or pulls away, it tugs on the retina, causing those flashes, and any debris or clumps in the gel appear as floaters.
Brilliant. These mnemonics and examples are really great for solidifying the knowledge. So as we wrap up this deep dive into sudden vision loss, what's the single most important message for our listeners to take away?
I think the crucial message, the absolute key takeaway, is that sudden vision loss is a serious symptom. It requires immediate medical attention. Full stop.
Right. Don't wait.
Don't wait. And understanding the wide variety of potential causes, from problems with blood flow to retinal issues, is essential for getting that timely diagnosis and the right treatment, which ultimately has a significant impact on the outcome.
And in this deep dive, we really covered the key aspects, the definition, the many causes or etiology, risk factors, how it affects the body, pathophysiology, the differential diagnoses, a bit on epidemiology, the clinical features to look for, investigations, management, prognosis, and potential complications.
We covered a lot of ground.
We did. And if you want to explore this topic further, maybe do some practice questions or access more resources for your learning and revision, be sure to visit pastthemsra.com.
And for even more free study materials to support your learning journey, you can also head over to freemsra.com.
Great resources. Finally, just to leave you with something to think about. Considering the really diverse range of causes we've discussed today, what specific questions do you think are most critical to ask a patient who presents with this alarming symptom of sudden vision loss to really help you pinpoint the underlying problem quickly? Something to ponder. Thanks for joining us for this important deep dive.